Good afternoon. Thanks for joining. My name is Torres, and I'm a nutritionist here at Dr. Tamarisa's office at Katie Integrative Gastroenterology. And with me today is Dara Parker and Kathy Gregory. Both of them are wonderful health coaches with their own businesses. And if you've missed it, we've been doing a 3-part series, with this video being the 3rd part on immune support. Our first recording was all about gut health and how to support your gut microbiome as kind of the underlying protector of our entire body and maintaining homeostasis and function overall, and the importance of supplement quality. And then our second video was led by Dara, and she talked all about foods and where we can find the nutrients that we need from our diet. And I think the big key takeaway was variety. Variety is the spice of life, and we need a variety of color and a variety of nutrients and things in our diet. So I encourage you to go back and check out those videos if you missed them. Otherwise, today we're going to be talking about all things lifestyle. A lot of times we tend to forget that health is full circle, and there are a lot of things that we can be doing outside of the doctor's office, outside of nutrition and diet, and Kathy's going to address those today.
Right. Well, thanks so much, Tara. So that's exactly right. Our lifestyle plays a big part in helping us support our health and specifically our immune health. And so I have a few items that I thought I would bring forward today around just some lifestyle activities that we can do that will help us better support our immune health. And so quickly, it's healthy diet, hydration, and minimizing stress. And so, as Tara said, we've discussed in the first 2 segments quite a bit about healthy diet and what that looks like. So please, if you haven't seen those 2 parts, please go back and take a look. But just kind of generally to summarize, we want to be eating whole foods. That's going to be the best thing for our gut and giving us the vitamins and nutrients that we need to be able to support our immune system. Hydration. So this is really a big one. In our circulatory system, there's something called lymph. I'm sure we've all heard of that, and it carries the infection-fighting immune cells around our body, and it's largely made up of water. And when we're dehydrated, of course, that really slows down the movement of the lymph, and that can lead to an impaired immune system. And so we want, even if we're not sweating or exercising, we are constantly losing water through our breath and through our excretion of urine as well as bowel movement. So it's very important that you understand how much water you need to intake in a day. A great recommendation is about half your body weight in ounces on a daily basis. And so that's, going to be different for each one of us because we weigh different weights. And also I would say too, that if you are exercising, and especially as we head into the hot summer months of Houston, we want to make sure that we are definitely keeping up with that water intake on a daily basis. It's not a kind of one and done thing for the week. You really have to keep up with it every single day. Number 2 is, actually that was hydration. So number 3 thing is minimizing our stress. And so there are a lot of us, for the most part these days, live in a chronic state of stress. And I would say that's even more so with the most recent pandemic. We have all this perceived stress that we have in our lives, and it causes our body to initiate a stress response. And those stress responses actually hinder our immune system, and that increases, of course, our chances for infection or illness. And of course, stress is different for everyone. we all handle it differently. We all have different stressors. We all have different ways of managing stress. And so it's very important that you get clear about that. Exactly, sit down, do some journaling, try to figure out exactly what's causing you stress. And just as importantly, figure out things that help you to reduce your stress. And here are a few ideas around that. Exercise. Exercise is a great way to reduce stress. It helps our circulatory system. It helps us to get our immune cells and infection fighting molecules to move and travel around in our body better. Studies have shown that as little as 30 minutes of exercise a day can be very helpful as far as helping us to reduce stress and helps our immune system. Tara, do you have any thoughts around that for us?
I do. I'm a nutritionist now, but I started off as a personal trainer, and much like patient healthcare and nutrition therapy, exercise is really an individualized and unique approach to everybody. And sometimes that means for patients that they just have to start small. It can be a 20-minute walk a few times a week, 2 or 3 times a week at the beginning, that you gradually increase to 30 minutes, that you gradually increase to 4 or 5 days a week. And, with practice, that could eventually lead to a faster walk. It could lead to a jog or a run. It could lead to yoga or strength training. There's varying degrees about it. And I think it's really important to understand that as a patient, to not bite off more than you can chew and just start small and gradual. And that will do wonders for your health overall.
That's a great point. Yes. So all of these, for sure, it's all about just taking what you think that can work best for your life and your lifestyle, and start somewhere and then gradually add in more activity. And so exercise is definitely a great example of that. Start small and just add. So sleep is another activity that can be a great help in reducing stress. It is one of those things that helps also to support immune system when you're getting good sleep. It's recommended that you get between 7 to 9 hours of sleep a night. And what I really want you to focus on is the quality of the sleep. We have sleep cycles, and we need our body to go through all the cycles and not be cut short in order for it to heal and do what it needs to do from an immunity standpoint every night. I have a couple of tips that I'd like to throw out for getting better sleep. Try to put together some sort of bedtime routine. Just like most of us have a morning routine, you need some sort of bedtime routine that helps your mind to start to shut down, to calm down, get in a calm place where you're able to get into bed and go to sleep. That can be, of course, different things for different people. It could be reading a book. It could be sipping a cup of tea. It could be washing your face, taking a bath, that sort of thing. But again, it's one of those things that you need to kind of know about yourself and figure out what works best for you. Making sure that your room is a cool temperature has been shown to help with better sleep. Complete darkness, making sure there's no light around. Trying to limit electronic usage about an hour before you go to bed. Taking away that blue light helps our mind to shut down. And also caffeine and alcohol can be sleep interrupters. And so caffeine's pretty obvious. I think we kind of understand that. Alcohol too, though. If you a lot of people I know will have a glass of wine or whatever at night before they go to bed. But if you take it too far to the extreme, it can be something that interrupts your sleep at night. So that's something to think about too. If you're not getting good sleep, maybe how much you're drinking before you go to bed. Another great activity that you can implement to help reduce stress is breathing. And so what we want to do when we're practicing a breathing exercise is that we want to really slow it down and focus. And so there are so many breathing practices out there. And in fact, Tara recently posted one on social media. It's the 4-7-8 breath technique. It's very good. I actually personally use it a lot, especially if I wake up in the middle of the night and having a hard time to go back to sleep. It really helps me. But what we really want in really any breathing exercise is just about slowing the breath down, focusing on the breath or focusing on your senses, focusing on something to get your mind out of that stress response that it's having. And those breathing techniques are a great way to do that. Lastly is we're going to talk a bit about mindset. So we are what we focus our thoughts on. And so when we consume a lot of negative things, we can really quickly get into a very stressful mindset. And kind of conversely, when we have a more positive mindset, we're able to control our thoughts and be more focused, and we can keep ourselves out of that stress response. And I know, Dara, recently you've been doing lots of great research and posting around that topic, and I just wanted to kind of get your thoughts on that.
Sure. And you, excuse me, you touched on it a little bit, but a lot of our stress, as we're learning, is perceived, right? It's not things that are actually happening in real life. When we have stress, it's usually the what ifs, and usually the thoughts that surround that perceived reality are negative. So our reality is based on those perceptions and those beliefs, and they're not facts usually. And that's where the stress comes in. So one of the things that I talk to clients about who feel a little bit paralyzed by fear, stress, and anxiety is changing the dialogue, because everything that we say, our cells respond to those things, especially with immunity. So instead of saying things like, why is this happening to me, changing it to, why is this happening for me? And maybe figuring out what that lesson is when something stressful is happening, or what you perceive as stressful. I know right now a lot of people feel a lot of stress around the pandemic. And I've tried to even myself talk to myself and say things like, because this is happening, I now have the opportunity to, rather than, I'm so frustrated, I can't believe this is happening. You know, a lot of times those words are what fuel our behaviors and our mindset. So changing that script can be so powerful.
Very good. That's so true. Absolutely. And so I guess this is a pretty high level, of course, discussion around all these topics. And if you wanted to dive deeper into any of them, I'm sure that each one of us would be happy to help you with any of that. But these are kind of my top few lifestyle changes that you could begin to implement into your life that would make a real and lasting change for you.
Thank you so much, Kathy. That was great. I hope you guys enjoyed recording these as much as I do. And I hope our patients and our clients find some value from them. There's been a wealth of information, and some of the things I know that we could go down the rabbit hole and discuss way more in depth, but I think this was a good start, and I look forward to continuing the conversation in the future.
Thank you.
Thank you for having us.